Hello, welcome back. I hope you enjoyed your practice in the knee joint, right? Did you feel some difference in your internal and in the external movements, right? Did you feel some pain there? Did you feel some stretch there? Did you feel that how the hyperextension can lead to injury, right? Knee health. And most importantly, I hope your mentor must have told you from where that movement should come so that knee doesn't get any injury, right? Keep in mind. Now, next, we are going to work on the ankle, okay? Or the big brother of the knee joint. We showed you the knee, the tiny one, and this is the knee. Can you see? Femur, the big one, with bones. The tibia, the big bone here. The fibula attaching to it. And then we're talking about the ankle. So what is the ankle? Foot and the tibia. Here in between, we call something called tarsals. Like in the wrist, we discuss about the carpals, 8 small bones. Similarly, we have not small, comparatively, if you will see, they're not that small, but we have 7 bones. 7 bones, we call them tarsals. Okay. One is your calcaneus, we call it heel, right? In layman term, calcaneus. This is the one. Can you see from where it is going all the way here? Look at this. This is whole one bone. This is calcaneus, one, right? Then look at on top, just on top of it here. This is talus. Can you see? Another bone, talus, okay, on top. So calcaneus 1, talus 2. Then if you will see on the medial side or on the lateral side, this means on the pinky finger side here. Here, there is one bone outside here, just pinky finger, metatarsal, and then this is the tarsal cuboid. It looks like cuboid, cube, okay? Next to the cuboid, if you will see right here, on the big thumb side, it is navicular bone, okay? Navicular. So, calcaneus 1, talus 2, cuboid 3, navicular 4, and then we have 3 bones on top. If you will see 1, 2, and 3. Now you can call them medial, middle, and lateral. Medial, middle, and lateral. So here 1, 2, 3 cuneiforms. Okay. So calcaneus 1, talus 2, cuboid 3, navicular 4 on top, and then these 3 in the front, 2, 3. Okay, 7, we call them tarsals. They are forming your ankle joint. Okay, so in the ankle joint, what all movements do we have? Plantar flexion, dorsiflexion. The plantar flexion, when the toes are pointing away, and when the toes are moving towards the shin bone. We also call it shin bone, tibia. Okay, this. So you do yoga asana, you do other fitness activities, you see that every time you are sitting down or moving, right, your foot, your ankle is going like this every time, plantar flexion, dorsiflexion. Okay, your mentor will tell you after this that how you can get the impingements right in the front or behind, okay, right in the front or behind in the yoga asanas. And then when you will get those impingements, what you can do about it. So you will get to the prop work for that. You will get the modifications for that. Okay. And then you will also get to know that when it is your muscular thing and when it is your joint related thing. All right. You will also get to know the testing so that you can find out that if there is some asymmetry between your both the sides that your mentor will tell you. Okay. The testing wherein you will see the range of motion of the dorsiflexion. All right. Cool. So this is the anatomy of your ankle. Simple, simplified, isn't it? Cool. So this is how we have covered till now from the top. We have done the wrist, we have done the elbow, we have done the shoulder, the scapula, we have done the neck, we have done the thoracic, we have done the lumbar, we have done the sacrum, SI joint, we have done the hip joint, knee joint, and the ankle. Wonderful. Great. I hope you have learned something out of this course. I hope you're applying already this knowledge in your day-to-day activity, in your yoga asana, in your fitness activity, in your day-to-day movements, right? Isn't it? Please keep on trying, keep on implementing these, because these are the tricks, these are the knowledges, information which will save you from any injury. Prevention is better than cure. Please remember that. Keep practicing. Try these asanas, try these techniques in your practice, in your teachings, and see the difference. Okay. I'll see you next time. Bye bye. Take care. Have a nice day.